First, I would like to start with an overview. Today, I will be talking about what is lymphogranuloma venereum, some background research, some history on it, how it is transmitted, symptoms, stages, how it is diagnosed, treatment for LGV, prevention techniques, and also an experiment and future research. First off, background research. What you will need to know is what the lymphatic system actually is. This right here is the lymphatic system that lymphogranuloma venereum deals with. The lymphatic system is a drainage system that is responsible for collecting and returning intestinal fluid. This system is made up of capillaries and tubes. It is also responsible for lymphs. Lymphs are made up of water, protein, salts, and glucose, and they often drain the water, they often drain the water, which is also known as pus. The lymphatic system is made up of bone marrow, lymph nodes, the spleen, and the thymus gland. The lymph nodes provide an environment where the lymphocytes can gain exposure to antigens, and antigens are like bacteria and fungi. Next, what is lymphogranuloma venereum? Lymphogranuloma venereum is a sexually transmitted disease that occurs in the genital area of your body. It can occur in males or females. This is a picture of the actual lymph nodes expanding. When the lymph nodes expand, they let go of lymph. Lymph is the fluid. So right here, they're in a maximum captivity of how much lymph they can hold. So as you can see, this one has already bursted and the lymph has already leaked out. But here, the lymph is coming out slowly and continuously. This process happens for about 4 or 5 days. History of lymphogranuloma venereum. Lymphogranuloma venereum has existed since the early 1800s. It has existed mainly in Haiti and Russia. The reason it has existed in Haiti is due to sanitation reasons and their lack of knowledge on sexual activities such as how to get access to protection. How is lymphogranuloma venereum transferred from organism to organism? Lymphogranuloma venereum is transferred from organism to organism by sexual activity. It can be transferred by oral, vaginal, or anal sex. It is transferred because of the bacteria that you transfer when you have sexual intercourses. Symptoms. Symptoms include drainage to the skin from the lymph nodes in the groin area, painful bowel movements, small painless sores on the male genitals and in the female urinary tract. The female urinary tract consists of the kidneys, the renal pelvis, the ureter, the urinary bladder, and lastly the urethra. The male genital tract, in this instance, specifically the phallus. The phallus is also another word for the penis. Next, there is swelling and redness of the skin in the groin area. This swelling has also been said to be described as like sunburn, and it's just an unbearable pain that you can't get away, that you can't get to go away for a very long time. Symptoms continue. Also, there's swelling of the labia. The labia is defined as the anatomical structure that is a part of the female genitalia. The anatomical means of or relating to bodily structure. So you can't clearly see it, but right here is the labia, and the labia swells, and the labia is just the access hole to the female vagina. And what happens is it can close and it swells up, and there's just bumps that form on it. Lastly, there are swollen and growing lymph nodes on both or one side. The lymph nodes are right here and right here. As you can see, hers are very big because they have been growing for a very long time, specifically 3 weeks. And as you can see, their maximum capacity, and they are bound to leak in any minute. The stages. The first stage occurs 3 to 30 days after the infection has been put in place. The first stage commonly goes unnoticed, but there are some symptoms. The symptoms are marked by formation of painless, herpetiform ulceration at the site of the infection. These ulcers are mainly like big bumps that they burn. It is described to be like a first-degree burn that you just can't get away from. And mainly people take Motrin for it because they just want the pain to go away. Next, the second stage occurs 2 to 6 weeks after primary lesion. The painful swollen lymph nodes coalesce to form bullous. The primary lesion is directly associated with the disease process and is described with established dermatological terminology. Primary lesion includes the macula, the papule, the patch, the plaque, the vessel, the bulla, the nodule, the tumor, the wheal, and the pustule. Some important definitions. These are very important definitions. And the macula means a patch of the skin that is discolored but not usually elevated. A papule is a small, raised, solid, simple, or swelling, often forming a rash on the skin, typically inflamed. A patch is used to strengthen the disease to bind it together. A plaque is a circumcised, superficial, solid lesion. A vesicule is a superficial, circumcised elevation of the skin. A bulla is a lesion that contains fluid. A tumor is a solid lesion, and a wheal is a transient, circumcised plaque. Next, the second stage symptoms consist of fever, chills, and myglacis and malaise. Myglacis is a pain in a muscle or group of muscles, and a malaise is a general feeling of discomfort, illness, or uneasiness whose exact cause is difficult to identify. Next is the third stage. The third stage is usually described as genital anorectal syndrome. Genital anorectal syndrome is a rare disorder with characteristics of craniofacial features. Craniofacial just has to deal with the cranial region of your body and the facial region of your body. The symptoms of the third stage include rectal pain, bloody purulent discharge, and tenesmus. The rectal pain is known to cause enlarged swelling veins in the anus, infections such as small bumps, and also disease such as Crohn's disease. Crohn's disease is an inflammatory bowel movement disease, and that means it hurts when you discharge your waste. Also, it is known to cause prostate cancer. And lastly, the bloody purulent discharge is when blood comes out of the rectum at the time of feces discharge. Tenesmus purulent is a continuously or reoccurring inclination to evacuate the bowels. Inclination means the natural tendency to act or feel in a particular way. How is it diagnosed? It is diagnosed basically by physical appearance. The doctors first examine your genital area and see do they see any swelling in the lymph nodes or anywhere else. And also, there has been a case where X-rays have been performed to see is there any swelling anywhere else in the body, because the lymphatic system goes all the way through your body, so they could possibly see from that. Treatment for LGD. Treatment consists of a series of antibiotics. These antibiotics are tetracycline, dioxycycline, erythromycin, azithromycin, coalesced bowis, and tenesmus. How do you prevent lymphogranuloma venereum? You can prevent it by being abstinent, or practicing safe sex can lower the risk, but it can't always protect you from it. An experiment. Well, the first experiment has to do with mice. Altogether there were 193 mice, and the experiment went on for 277 days. First, twice daily oral doses of 0.5 milligrams of quinoxaline 1,4-dioxide per 20 grams was injected into the mice. This was done for 277 days. After the 45th day, the first observation was taken. This observation concluded that 166 of the 193 that carried the disease survived. The 166 of the mice that carried it were re-inoculated with the virus again. After this, out of 166, 37 mice were still surviving to the 37th day. And then again, they were re-inoculated with the virus. After this, the results came out to only 29 mice survived after the re-inoculation, and this continued on for three more samples. After this, they concluded that none of the 29 mice died, so they concluded the vaccine worked. But currently, vaccine has shown not to be able to work due to the formation of antibodies that has formed when the antibiotics have been put in place. So doctors have recalled the treatment, and they are trying to come up with a treatment right now. Future research. Since 2003, there has been a massive outbreak of lymphogranuloma venereum in the United States. So it is said that 71% of people who have reported lymphogranuloma venereum, they have also obtained HIV. this has the inhibitor that has been provided to these patients is non-nucleoside reverse transcriptase inhibitors, which means bind directly to reverse transcriptase and prevent RNA conversion to DNA. It is often used in combination with other drugs. Any questions, comments, or constructive criticism?
Because the only diagnosis is physical, can it be mistaken for any other like STD?
Yes, it is commonly mistaken for another disease called pistachios, and pistachios is like it's just like bumps forming on all areas of the body, and sometimes it's mistaken for that disease.
You said that it's mostly found in third world countries, especially maybe in Russia. So why is it mostly found in Russia?
I didn't come across that in my research.
So going off of Joy's question, if it's commonly mistaken, if it could be commonly mistaken for another disease, are there any other diagnostic tests that a physician can use to determine?
When it's like a very severe circumstance, they can surgically go in and look at the lymph node and see is it expanding or is there anything that's going wrong in the body.
There are no like lymph tests or anything like that, like blood tests type things?
No.
Okay.
Ms. Robinson?
What other disease could it be mistaken for?
It's called pistachios.
In your research, did you come across IBS?